case you're wondering, and I think you can probably see, we have, I don't know, how many is that, 15 or so? 13. So you're here because we had a full-time presentation from Shelley Howell, our HR director, to talk about COVID workplace issues and try to answer any questions you might have. She has a pretty thorough presentation which she wants to go through completely and then try to answer questions at the end because it flows better with a Zoom meeting. So if you could hold on to your questions, that would be awesome. You know, jot them down or even type them into the chat box so that at the end we can kind of hit on some of those. Just to kind of kick things off, when we did this last week with the full-time folks, we shared with them that we were aware that we had had a positive COVID test inside the district family among all the, you know, employees, which given the spread in the community isn't completely a surprise. But now we have 2 positives within the district. So we are going to go through and talk about what it means in hypothetical situations when someone does get tested and is positive and they're in the workplace. So we'll be trying to share with you what we're doing. The purpose of this is to give you guys information, and information and knowledge is power, so that you are aware of what you can do to protect yourself, to protect your coworkers, if you're working with the public, but also we're hoping what we try to do here is allay some fears as well. And, you know, if you feel like you have any unanswered questions, we want to try to answer them, and we'll do that today. And if we can't do it today, we'll try to get back to you with those. So with that, I am going to now turn it over to Shelley to kick off her presentation. Thanks.
Okay, thank you. Welcome, everybody. We are now, like 4 months into this now, so I think early on we're all learning. A lot of information is changing, but we really wanted to kind of go through some of the information, provide some reminders, and also kind of procedures. So the first thing is going to be a few of our preventive reminders. Number 1 being we're asking all of our employees to wear cloth face coverings indoors in any common area where you may be in contact with others. So that might be in common areas like hallways, common rooms, but also even if you're in your own private workspace and, you know, someone comes in to communicate with you, please wear your face covering outdoors, or at any time actually when you're engaging in the public, with the public, or anytime there's not possibility of having that 6 foot difference. Of course, we want everybody to maintain the 6 foot physical distancing. Wear it properly, which will cover both your nose and your mouth. Wash it daily. And if you don't have a face covering, we do have them available. We still have some available. Please contact Rosie. We have some of these nice green face cloths, courtesy of our senior volunteers who made them for us. Secondly, just some preventive things that we've all, you know, had instructions on, but wash our hands often, frequently with soap and water for at least 20 seconds. Use hand sanitizer when washing your hands is not possible. Avoid touching your face, your nose, your mouth, and again, maintain that 6 foot distancing. And again, cleaning and disinfecting. We have in each one of our work sites, first of all, we have the work site specific plans that we've developed for every site. So hopefully you know about these and you've talked with your supervisor about them. If you have any questions, please talk to your supervisor. But we have set forth procedures on how to do our additional cleaning and disinfecting in the workplace. Each of us is responsible for our own workspace for cleaning. So I clean my desk, my phone, my computer. And we're asking everybody, there is an individual and a shared responsibility of each of us to keep our workplace clean for any common areas. So first of all, if you can avoid sharing things, then that would be the best thing, but anything else, we have, for instance, at Hillcrest Center, we have, in every conference room, we have disinfectant cloths available. And our procedure is to clean anything that is shared before you use it. That's the best way for you to know that it's clean and already disinfected. Of course, we ask for you to do it afterwards too, to kind of leave no trace, but that's the best thing, that disinfectants and cleaners are available, that we're all cleaning the areas that might be touched in the kitchen, in the microwave, you know, those areas in the copy room, those things that we might each touch. And then now allow enough time in the workday to do that, so that we're making sure that that's done consistently and diligently. And then we're asking each employee to monitor your own health, to self-screen before you come to work. If you can, take your temperature. CDC guideline is anything over 100.4, stay home. Stay home if you're sick. If you have any question at all, or if you have any of the symptoms that have been identified as possible COVID symptoms, stay home to protect yourself and others. Know how it spreads, because mainly it's been identified as person to person. So from one infected person through respiratory droplets, from coughing, sneezing, or even talking. It can even spread from person to person when someone has no symptoms. It's something like 40% or more that they're finding people who have no symptoms at all who may spread it. And then surface transmission, although this is not identified as a primary way, but you know, somebody who is infected touches something and then another person comes along and touches it and then maybe touches their face or nose. So again, that's why we want to be diligent in our cleaning and disinfecting. So the symptoms, CDC has revised their list of symptoms, I think a couple of times now. So the primary ones have been identified as fevers or chills, cough, shortness of breath, or difficulty breathing. But some additional symptoms that they've identified: muscle pain, sore throat, new loss of taste or smell, congestion or runny nose, nausea, vomiting, or even diarrhea. So the CDC website is the best source of to look at those symptoms. They even have a symptom self-checker. It's kind of like a little questionnaire that you can follow along and it will give you guidance. If you're sick with either COVID or you think you might have COVID, stay home except to get medical care. Contact your provider for guidance. We're not scientists or medical providers, so the best source is going to be your medical provider. Separate yourself from other people if you can, and of course, notify your supervisor. A couple of terms that you may have heard that I just want to review. The first is quarantine. Quarantine is a term that has been used to keep someone who has been identified as being in close contact with someone who may be positive and keep them away from others because it's been identified that symptoms may not appear for 2 to 14 days after exposure. So someone who's been asked to quarantine is asked to stay home for 14 days from their last known contact with someone. Watch for symptoms, take your temperature maybe a couple of times a day, and stay away from others. Isolation, on the other hand, has been used to keep someone who is sick or known to be positive isolated. So stay home, try to definitely keep away from anybody that you can, even in your own home. If you are sick or think you have COVID, what are the guidelines for the duration of time that you should stay away from others? And there are 4 things. The first is 3 days or 72 hours with no fever, without any fever reducing medication. So fever-free with no medication, and any related symptoms, if there were also symptoms, have significantly improved in the last 72 hours. And 10 days have passed since those first symptoms first appeared. And of course, you complied with all your doctors, your healthcare providers' recommendations and guidelines. So all of those are not ors, it's and. So all of those things, each and every one. If you have tested positive for COVID-19 but have no symptoms, the guidelines are to stay home till at least 10 days have passed since the test. And then of course, depending on your healthcare provider's guidance and testing guidelines at the time, they may recommend retesting to make sure that you have a negative test. If you will be tested, I've seen one of the guidelines is to have 2 negative tests within 24 hours. Again, as we slow down a bit and more people are getting tested and there's more and more cases, they may prioritize those tests, you know, in each county depending on the needs. So what is a close contact? So we're saying people who have had close contact with an individual are going to be asked to quarantine. A close contact by the guidelines of the CDC is anybody who has been within 6 feet of an infected individual for a prolonged period of time, that being 10 to 15 minutes at one time. Especially, they say, within the 2 days before someone's symptoms first appeared, or 2 days before the test date if somebody is asymptomatic. So how do we do that? So if we learn about somebody who is tested positive, then we will work with that individual to have them identify any others, and that is any coworkers who they have had close contact with, or that they may feel has had an increased exposure. Those individuals will be contacted directly and directed to quarantine for 14 days from that last known exposure. I want to talk about that last known exposure too, because the CDC website has also put on their website some good scenarios about last known exposure. So if for instance, there's someone in your home and it's the last you had exposure to them, then you're asked to stay away from them for 14 days. Well, if in your household you can do that, somebody can stay in their room and you're not using, you know, you're staying 6 feet apart, then again, it's 14 days. If you have another close contact, another 10, 15 minute close contact with them, your 14 days restarts. So again, it's 14 days from the last known exposure. If there's multiple people in the household and one person tests positive, but they're able to isolate themselves, and then 5 days later, family member number 2 tests positive and you've had close contact with them, again, the 14-day quarantine starts over. If you have a household where it's not possible to isolate from, you know, ill family members, or if you're caring for them directly, then it's once that person has been able to go out, and it's 14 days from that. Again, it's 14 days from the last exposure, so it could be a prolonged period of time. Your provider is going to be the best source of information. So what if you have been identified as a close contact of someone who has tested positive? And as some people are learning, it might be from somebody at work, but you might get a call from public health through they're doing their own contact tracing. Anytime there's a positive test, it's reported to public health, and every county is doing contact tracing. But you will be asked to self-quarantine for 14 days. Again, monitor yourself for symptoms and contact your provider for guidance. What if you are in close contact with someone who has been exposed to a confirmed case? So this is kind of a secondary contact. You know somebody who has been exposed to a positive case. So the guideline for that is if you are healthy and the exposed person that you come in contact does not have any symptoms, then it's recommended you just take every day the preventive measures. Again, you know, 6 feet distancing, face masks, cleaning, washing hands, etc. But again, if you have any concerns based on maybe an underlying health condition or a close family member, you know, you're concerned about, you know, at your home who has underlying conditions that put them at a greater risk, contact your provider for guidance. So what if you've been identified as a close contact and again, you're asked to quarantine for 14 days, but you go get a test and that test result comes back negative? Are you able to return to work then? And so again, the guideline is 14 days from the last known exposure, and because it does take 2 to 14 days for symptoms to appear, the test is only as good as the date that the swab or the test, whatever kind of test was taken. If it's early enough from the exposure, you may not have developed the viral load to test positive. So even if you have a negative test before the 14 days is up, you will be asked to remain at home and off work for the full 14 days. And if you develop no symptoms, you're able to return to work. If during that 14 days, your health changes and you do develop symptoms, we're going to follow the healthcare provider's guidance on when you can return to work. I did see an article that said a false negative can take place up to 40% of the time if you're tested within the first 4 days of being exposed. So when can you return to work? So if an employee develops any of the symptoms identified as COVID related, remember that we're not doctors. We don't know if it's COVID related or not. So if an employee identifies any of the COVID related symptoms, we're going to ask them to remain off work, to contact their provider for guidance, and they can return to work either with a doctor's note that releases them back to work, or we've developed a self-certification form that in the absence of a doctor's note, or if that person can't get to a doctor, then they self-certify. And the self-certification includes all of those 4 things I mentioned earlier. So 14 days from either exposure, testing, close contact, and 3 days with no fever, and 72 hours improved symptoms, and 10 days since symptoms appeared, and they followed all their provider's guidance. So some people, might get concerned if I have congestion and, diarrhea, do I have to stay off for 14 days? Well, the answer is not necessarily. Contact your provider for guidance and evaluation. Providers are the best, they're the medically trained people who can evaluate, talk to you about all your other symptoms, any, possible exposures or that kind of situation. And they're doing a lot by telehealth. So, they're doing a lot by phone, telemed appointments, and they can evaluate. And I have seen cases where people can, the provider determines whether or not it's COVID related and then releases them back to work. And finally, I just want to mention about leaves that are available. So the Families First Coronavirus Act provides us all employees of the district with emergency paid sick leave in the event that the employee has a need for a COVID-related absence. It provides 2 weeks of emergency paid sick leave if the employee individually is affected. So either if they're sick, if they're self-quarantining or isolating, or if they are sick and seeking a medical diagnosis. So you have some symptom and you're not sure yet whether it's COVID during that time while you're seeking a medical diagnosis, then that emergency paid sick leave is available to you. And it's available through the end of the year. It's also available if you're caring for somebody in one of those circumstances. So if you have a family member and you have to take off for that purpose. And finally, I just want to mention about medical confidentiality of medical information. We're not going to identify anybody that has been tested positive, but like I said, we would work with that person to identify any close contacts and then speak individually with that person. If anybody individually feels like they have had a direct exposure, then I would ask them to, we'll work together and investigate what that exposure is and work with the parties. But most of all, we want everybody to stay safe, work together to help protect ourselves and our coworkers. And with that, if anybody has any questions, we'll take questions. You can touch the little button, I think, that has the raise hand, or type in a comment.
Apparently that was a very, very thorough presentation, Shelley. Well done. I can see why you were recognized as being the management services park employee of the month for November. So July. What am I thinking? November. July. Oh, did I let the cat out of the bag? You got November too.
All right. Well, if you do think of any questions later, or if you have any individual questions, please feel free to call me, email me. We're available. It's a lot of information. You probably, experience it, the news, the CDC website gets updated all the time. New guidance comes out as things changes. We speed up, we slow down. So again, we want to make sure everybody's safe. And as things change, or if you become affected, then, you may have different questions then. So please call.
And as we say goodbye, I can not see who, from where I'm sitting, I can't see all the way over to the TV and all the names, but I want to take a moment to thank especially the part-timers, the folks that are actually the face out in the field with all of the public, those of you that are kind of keeping our interactions with the public alive in this time. I greatly appreciate that. The board, I know, is so appreciative of what you guys are doing. The folks doing the camps, the folks feeding the seniors, just all the different ways that we're still touching the community, 6 feet apart, touching the community. But it's so important what you're doing, and I think the essentiality of what you do and the district's doing is getting pretty evident. So thank you for everything you're doing out there. And to the extent you have friends also working for CRPD and haven't seen this presentation, hopefully their supervisors or even you can encourage them to see this, because we will have this was recorded and will be available. So Mark will send out a link or something to all the supervisors so they can see it. Thanks.
Thank you.